Statistics by the CDC have stated approximately 1.6 to 3.8 million sports-related concussions are diagnosed annually in the United States. This statement inevitably gains the attention and curiosity of populations who are involved in concussion management, have personally experienced a concussion, or who are currently participating in an activity where the risk for sustaining a concussion has been made clear. Athletic trainers and sport medicine practitioners are sought out by patients who have sustained a concussion due to the expertise they bring on the topic. Therefore, having knowledge and staying up to date on how to identify, evaluate, and treat sports-related concussions is important for these professionals. My name is Kesenya Havlicek, a graduate student at Bethel University, and I am excited to share with you my findings in regard to concussion treatment. The purpose of my study was to answer the question, do pediatrics and young people who have been diagnosed with a concussion have decreased symptoms and a quicker return to play when subthreshold aerobic exercise is used in their treatment versus rest alone? Going forward, I will address the steps taken to analyze the research, discuss the answer to my question, and identify a few implications. Articles for this clinical review of the literature came from using ClickSearch, PubMed, Google Scholar, recommendations by medical professionals, and hand searching. Initial results yielded approximately 550 peer-reviewed articles. Then, additional keywords were added to the search to aid in narrowing the number of hits to 12 articles. To be included in the review, articles needed to incorporate participants between the ages of 5 and 24. They also needed to use subthreshold aerobic activity or rest as an intervention, as well as be written in English. Articles were excluded if the study was conducted over a decade ago. Evidence appraisal was conducted through the use of the Pedro scale for randomized control trials and quasi-experimental trials, and CAPS questionnaire for cohort and case studies. Articles were considered excellent quality if they scored a 9 to 10, good quality if they scored a 6 to 8, or fair if scored 5 or lower on the Pedro scale. When the CAPS questionnaire was used, the article was considered of good quality when all questions were answered. In total, 3 articles were of excellent quality, 8 articles were of good quality, and 1 article was fair quality. To explain the results and summaries of my findings, I've categorized the articles into their respective quality groups. First, 3 articles were considered excellent quality. The first article found patient symptoms improved quicker in the subthreshold aerobic exercise group than in the stretching group. The second article in this category was pivotal to the understanding of subthreshold aerobic activity because it was the first study to use specific parameters to verify the use of subthreshold aerobic activity within the first week of a sustained concussion. The third article with excellent quality determined the Buffalo concussion treadmill test was safe to use in order to prescribe subthreshold aerobic activity. In total, 8 articles were of good quality. The first 3 articles in this group were very similar to each other, and all made the conclusion that use of subthreshold aerobic activity resulted in improved symptoms. The next 2 articles found activity within 1 week was beneficial for recovery. The 6th article in this category studied the use of rest as a concussion treatment compared to a standard care approach, and concluded by advocating for the standard care over prolonged rest. The last 2 articles were based on each other, and found rest to be beneficial for concussion treatment. Both of these studies are of good quality, but also some of the oldest articles included in this critical review of the literature. 1 article was considered fair. This study had split results. For patients diagnosed with a concussion who also had signs, such as loss of consciousness, benefited from more rest, whereas patients diagnosed with a concussion based only on symptoms had better results when participating in a standard care approach over rest. Overall, 83% of the articles either recommended subthreshold aerobic activity, demonstrated that it was safe, or concluded rest to be more harmful than subthreshold aerobic activity in concussion rehabilitation. 2 articles exclusively suggest rest as a quality intervention for concussion treatment. One strength was that 7 articles were randomized control trials, and one weakness was overall low sample sizes. The findings of this critical review of the literature validate the use of subthreshold aerobic activity as a treatment more effective than rest for pediatric and young patients diagnosed with a concussion. The use of subthreshold aerobic activity is safe and beneficial post-concussion. Instead of waiting for symptoms to resolve, an athlete should be started on a protocol introducing subthreshold aerobic activity as soon as a few days post-injury. If treatment has already been delayed and the patient has been symptomatic for months, they will still benefit from subthreshold aerobic activity. These findings challenge the current clinical practice of rest for post-concussion treatment and encourages athletic trainers and physicians who manage concussions to adopt a treatment protocol with subthreshold aerobic activity. For example, the protocol often recommends the athlete to exercise aerobically daily, or almost daily for a set amount of time, usually around 15 to 20 minutes. In addition, the activity is completed at 60 to 80% of the patient's maximal target heart rate. However, exertional testing is done first, typically with the Buffalo Concussion Treadmill test, to see how their body responds to the intervention and if their symptoms worsen. If the patient worsens, the activity is stopped, and the heart rate where the patient's symptoms began to increase becomes the patient's individualized program boundaries while completing the activity at home. After that, the patient continues to report how they are feeling, and advancements in their treatment are made as they improve. Minimal to no equipment is necessary to administer subthreshold aerobic activity, which makes it very reasonable for athletic trainers to adopt in a variety of settings. Additionally, athletic training education programs should include these findings in their curriculum, as the research is consistent and will allow future athletic trainers to treat pediatric and young people who have sustained a sports-related concussion with best practice. Further research is still needed in an extended age range and with a larger number of participants. In conclusion, when the two interventions, rest and subthreshold aerobic activity, are compared to each other, the patients who participated in subthreshold aerobic activity improved quicker in terms of their symptom scores and duration of injury. The question, do pediatrics and young people who have been diagnosed with a concussion have decreased symptoms and a quicker return to play when subthreshold aerobic exercise is used in their treatment versus rest alone, has clearly been answered. Yes, indeed, subthreshold aerobic activity is a beneficial intervention for pediatric and young people who have sustained a sport-related concussion.